I'm Leanne Redman, and this training for the NPH study is to provide an overview of Module 1. Module 1 is a cross-sectional study that will include at least 10,000 individuals who are enrolled in the All of Us research program. The aim of Module 1 is to characterize daily dietary intake and accompanying nutritional status, as well as to collect biological and other measures over 10 days and to examine physiological responses to a liquid mixed meal tolerance test. This is shown here in the figure where 10,000 people will enroll for a period of 10 days. Some assessments will occur at visit 1. Most of the assessments will occur over a 10-day observational period while the participants are at home pursuing their normal usual activities, and visit 2 will include a visit to the clinic where the participant will do a liquid mixed meal tolerance test and have other bodily as well as biospecimen collections. Individuals who will be enrolled in Module 1 are required to satisfy a number of eligibility criteria. To be included in the NPH study, individuals must be at least 18 years of age or older, have completed the consent process for the All of Us research study, which includes an electronic health record consent, genetic return of results consent, and have provided at least one of the All of Us biospecimens suitable for DNA sequencing, and completed the participant provided information modules 1 through 3. The NPH study is able to enroll individuals who can speak and understand English, and at some sites this will also include individuals who are able to speak and understand Spanish. Individuals who enroll in NPH must be able and willing to comply with the study requirements and provide their informed consent prior to participation. Individuals who will be excluded from the Module 1 study would be those people who have had any change in their status in the All of Us research program that would render them ineligible, are unable to provide informed consent or to engage in the informed consent process, individuals who suffer from allergic reactions or are unwilling to consume any component of the liquid mixed meal, or also individuals who may find that having an IV for the mixed meal tolerance test would be unsafe. So this would include contraindications such as individuals with a local skin infection, inflammation, trauma or burns of the upper extremities, or if there are situations where placement of the catheter might be rendered unsafe. Additional exclusion criteria include some pregnancy-related conditions. Individuals would be excluded from the Module 1 study if they are of advanced gestational age, that is, that they are more than 36 weeks pregnant at the time of the visit. Visit 1 would need to be completed by gestational age 34 weeks, 0 days, with Module 1 fully completed by the 36th week of pregnancy. Individuals who are pregnant might also be excluded if they report severe morning sickness, which would limit them consuming the liquid mixed meal tolerance test, or other pregnancy complications that might prevent the liquid mixed meal tolerance test from being completed. There are several other disease states that might render somebody ineligible, and these include individuals with dumping syndrome or with an inability to consume at least 400 milliliters of liquid, individuals who report a severe malabsorption condition, such as a history of short gut syndrome or the need for parenteral or enteral nutrition, individuals who have had metabolic or bariatric surgery within the last year, individuals with a history of chronic pancreatitis, which would be complicated by the ability to tolerate a 400 millimeter liquid test, anemia that would require a blood or iron transfusion, anemia which will be defined in screening using a point of care device where hemoglobin would be less than 9.5 grams per deciliter, individuals who report serious illness and may be in hospice or palliative care for terminal disease, individuals who report swallowing issues, so this would be self-reported difficulty in tolerating solids or liquids, aspiration risks, or active antibiotic use following an ongoing acute infection, or finally, any disorder, unwillingness, or inability not covered by these exclusion criteria that the study investigative team or the medical staff may think would jeopardize the safety of the individual for enrolling in the Module 1 study, or the condition may interfere with the Module 1 protocol. Study screening is designed to be conducted remotely. This can occur by video conference, with the exception of the point-of-care testing for anemia. However, study screening may also be performed in person if it is desired by the study team and by the potential participant. Study screening will include a review of the potential NPH participant status in the All of Us research study. Study screening will also include the informed consent process with a clinical center staff member, and the informed consent form will be signed electronically. Screening will also include the point-of-care test for anemia. However, this may not be done at the same time as the assessment of the other eligibility criteria and the signing of the informed consent, as this test will be done in person and can be done at visit 1. Individuals who may be excluded from participation based on the anemia screening at visit 1 will be excluded at this time, but they may be able to be rescreened for eligibility in 3 months or when the anemia resolves. This is the intended visit flow for the Module 1 study. This would include a discussion of the NPH study, and in particular, the requirements for the Module 1, for completing Module 1. At the initial conversation, participants would be asked to sign the electronic consent form prior to ascertaining the eligibility status using an online survey, which would be conducted in an interview format with study staff. Individuals who would be deemed eligible, with the exception of the anemia screening, can be scheduled for the first study visit at a clinical center. This study visit includes a number of measures, which we'll review on the next slide. But first, it should begin with the point-of-care testing for anemia. Individuals who satisfy the anemia criterion can proceed to the visit 1 testing. Following visit 1, would be the 10-day observational period where the participant would engage in a number of measures to be collected at home while the participant is in their normal environment without changes to their diet, physical activity, or sleep behaviors. At the conclusion of the 10-day observational period, the participants return to the clinic for visit 2, where the mixed meal tolerance test will be conducted and also a number of body measurements will be performed. This is a schedule of the activities for the Module 1 study. As mentioned, the informed consent as well as the eligibility assessment may occur via video conference prior to visit 1, but it can also be done at visit 1 if that is preferred. Visit 1 is intended to be about 3 hours long. This is not a fasting visit, and this visit may occur over 1 or 2 visit days if it's preferred by the participant. At this visit, research staff will explain the study and ask the participant to review and sign the consent form if it was not done prior to the visit. Participants will also be asked questions about their health, and they will have a finger stick to collect a small amount of blood to measure anemia. After the participant is deemed to have met all of the eligibility criteria for enrolling in Module 1, the study staff can begin with the measurement of the other outcomes designated for this visit. This includes a collection of vital signs, including blood pressure, pulse, breathing rate, and temperature. It also will require that participants will be fitted with 2 devices. The first will be a continuous glucose monitor, which will be the Dexcom G6 device that will be inserted to the abdomen. In addition, participants will receive an actigraph accelerometer, and this will be located on the participant's wrist. The participant will also receive a sleep log to complete while the activity monitor is being worn. Participants will also be shown how to answer a number of different questionnaires. They may do this using virtually in the 10-day visit, or they also may start this during visit 1 at the clinic. During the at-home period, which will be around 2 weeks, the visit window range is 7 to 10 days. Participants will be required to wear the continuous glucose monitor throughout this time period and to wear the accelerometer and to complete the sleep log. Participants will also be trained on a number of different dietary assessment tools. They may be randomized to these different tools to complete during the 10-day at-home period. Participants will be asked to track their eating and drinking in a number of different ways. All participants will complete the dietary history questionnaire number 3, but in addition to that, participants may be asked to take pictures of what they eat and drink throughout the 10-day period, or to wear a pair of glasses that will take photographs automatically when they're eating and drinking. Participants will be sent reminders of these activities while they are at home. 7 to 10 days later, participants will return to the clinic to complete visit 2. This study visit will last up to about 8 hours. This study visit is required to be a fasting visit. That means that participants should have avoided food and drink except water for at least the past 8 hours before the appointment. At this study visit, the study staff will take a number of body measurements. This includes measurement of height and weight, hip and thigh circumferences, measure of body fat using a BIA machine, as well as vital signs, blood pressure, heart rate, breathing rate and temperature, a measure of grip strength for assessment of muscle strength, and a number of biospecimens will be collected prior to and during the mixed meal challenge test. This includes hair and nail samples, which are optional, as well as blood, urine, and saliva. At the conclusion of the visit, we will remove the continuous glucose monitor from the abdomen and we will collect the accelerometer. We will also collect the sleep log, and we will remind participants, if they haven't yet, to complete all remaining questionnaires. At the conclusion of the visit, we can talk to participants about their interest in completing the NPH Module 2 or Module 3 studies. Interested participants may have an interview with the dietitians or members of the dietary intervention team to discuss the Module 2 or Module 3 studies and to begin their eligibility for those 2 parts of the NPH study. Finally, here's the compensation plan for participants enrolled in the Module 1 study. In total, participants may receive up to $300 for completing the Module 1 study, and this may be prorated as follows, with completion of Visit 1 only being remunerated at $50, with completion of Visit 2 being remunerated at $250. Best of luck.